Good afternoon, everyone. Welcome to September office hours for Adirondack Health Institute Health Home. Thanks for joining today. I have the meeting being recorded as always, so we're going to have that on our website in the near future. I will also be sending out the deck from today's meeting to the distribution list. And if folks have questions or anything along the way, you can always use the chat function or ask along the way. Just want to confirm folks can hear me all right before we start our today's discussion.
You sound good to me, Travis.
All right, thank you. Thanks, Amber. I got a thumbs up from some folks. All right, good. I see the chat's working, so we're rolling. All right, so let's get going. So we're going to go over some policy and procedure stuff today, as usual. We have that on the calendar each month for our agenda, and we're going to talk about year 3 HCBS audit results, HCBS for supervisors review as well. A couple NetSmart topics, one on the comprehensive assessment. There's a new format, so we'll talk about that. And then care plan objectives, interventions. There's a new function there as well. And I just wanted to touch on the federal emergency waiver for COVID-19, a little bit of the NCCC, North Country Care Coordination Collaborative, just some training reminders. So that'll be today's flow. And we'll start off on our policy and procedure stuff. So Jessica's going to go over the HCBS disenrollment policy update that came out not too long ago. And we have in the hopper the CANS assessment because of some changes that went into effect as of September 7th of this year for the CANS and how that impacts plan of care. So Jessica will touch on that in some slides as well. But before she gets into HCBS disenrollment policy updates, I just wanted to remind folks that we have our health home policy and procedure page as well for folks to utilize that has all of our most current policies to date. So I'm going to move on to the disenrollment policy. Jessica, are you out there? Maybe not. You see, she's logged in. Might be having some issues with the audio though. But I can start until she gets. No, we can't hear you, Jess. WebEx difficulties. All right, she just chatted that in. So I can start going over the policy stuff, and while she's hopefully working out the audio issue that she's got. But wanted to just touch base on reasons for disenrollment for waiver through the policy itself. So we thought we'd highlight that stuff instead of pull up the whole policy and go through each page of it. But some disenrollment from waiver, some reasons for that. It's if a person has a loss of Medicaid, they're not eligible for on an annual level of care determination. They're in a restricted setting. So really, if they're not eligible any longer, that would be one reason for disenrollment. A parent or guardian withdrew consent for that person. That would also qualify for a reason for disenrollment. That person is not participating in their plan of care development. That would also be a reason. Not utilizing referred services. That would be a reason. And needs for that person have changed as well. Could be, not necessarily needing that waiver any longer. Alternate services may be more appropriate for that person, or they've graduated and the goals have been met for home and community-based services. Jessica just sent a chat that she wants to do her parts, so she'll be back. So I'll go past her section and we will come back to her. She has some things she wants to touch on it. So let me move forward. Let's see.
Hey, Travis,
Yes, you're back. Hello.
can you hear me?
We can.
Okay.
I was just gonna jump over your sections, but you're back, so I will back up to where we were.
Okay, I'm using my computer audio because apparently when I call in, no one can hear me, but my computer audio goes out. So if you can't hear me, please let me know.
Okay. So I went
Um,
back to slide 4, reasons for disenrollment from waiver for the HCBS disenrollment policy. I walked through that, but I didn't know if there's anything in particular you wanted to note to the group.
yes, I did hop off to try to come back on, so I did miss this. But just we reissued our policy for an update and then it was updated due to some of our audit result feedbacks. So we just wanted to re-review the policy and Travis went over the reasons for disenrollment from waiver. The most important things to keep in mind, the most popular ones that we see are that the member is no longer meeting eligibility for the waiver, and that is typical because our members are doing their annual level of care and they're coming out ineligible. In that instance, they would have to be disenrolled from HCBS, but could still stay in health home. And then another one of our popular reasons for disenrolling from HCBS is that the parent or guardian withdrew consent for their member or their child's to stay in the waiver. And that's typically because children are sitting on very long wait lists and children aren't getting access to services. So some of our families are deciding to disenroll. You can go to the next slide. So things to keep in mind is that if we're going to disenroll a youth from HCBS waiver, we have to make sure that we are doing the notice of decision for disenrollment. It's that 5288 form. You want to make sure that that form is completed, uploaded into the record prior to the actual disenrollment from waiver happening. The other important piece to keep in mind is that we have to communicate with capacity management to let them know that we have a member that is disenrolling from HCBS so they can remove those K codes. And you want to make sure that after you document that you've emailed capacity management and then you follow up and double check e-paces to make sure that those K codes are in fact being removed. If you have any issues with K codes not coming off, please reach out to me and I can follow up. If you are disenrolling a member from HCBS and from Health Home, we do have those new end reasons in the system that you can use and skip contacting capacity management. And you'll have to use one of those two new end reasons and not the actual end reason for disenrollment of Health Home in order to get those K codes removed. And then we want to make sure that anytime we're disenrolling anyone from HCBS waiver, that that is being communicated to the care team members and the managed care company as well, if there is one. Next slide. So things to remember that when we're disenrolling any of our members from HCBS waiver, any conversations about disenrollment from waiver, we need to make sure are documented in the record. And if the member is disenrolling from Health Home and they have HCBS, we want to make sure that we're following both disenrollment policies. You have to follow the workflow for HCBS disenrollment, and then you also need to follow the workflow for Health Home disenrollment. And then any and all forms need to be uploaded into NetSmart. When we're disenrolling someone from HCBS waiver, we have to update the plan of care. Anything pertaining to HCBS in the plan of care needs to be removed. It needs to be updated and amended at that time. And then again, you always want to verify that those K codes and all of the K codes have been removed from e-paces. If you're finding that you email capacity management or you use the new end reason and those K codes are not removed, please let me know and I can follow up with DOH. Next slide. So that's it for the disenrollment policy update. As you saw also on that previous slide that the CANS assessment policy is being updated and the memo went out that the CANS is now an annual assessment. The new policy will reflect that, and that will be out probably in the next couple of weeks. Also, with that policy change, there was the policy change to move the children's plan of care to an annual amendment to coincide with the CANS assessment. So our plan of care policy will also be updated to reflect that. But back to HCBS, we had our year 3 audit and we did receive our results. I will be emailing each CMA that had a record or records pulled for audit. The Department of Health gave us individual audit results this year, so I will be sending those out to each CMA. Right after this meeting, you'll get those in your email. If you have any questions on any of those individual results, you can email me, and hopefully we can figure out what you did and did not get credit for if you have any questions on there. But some of the highlights of our results were, again, our freedom of choice form. This has been on all 3 years of our audit. We need to make sure that after every level of care, so that's the initial and the annual, that the freedom of choice is completed after the level of care is done. You can't complete this form before you finalize the level of care, and you have to do it after the level of care, but before you refer for HCBS services. So we want to make sure that our timing on that is correct. The other thing that was noticed is our notice of discontinuance or disenrollment from HCBS needs to be on file. So if you would disenroll someone from HCBS, you have to make sure that that form is completed and it is in the record. Another thing that the Department of Health highlighted for us to work on is that our plan of cares for HCBS need to be completed within 30 days of the level of care being done. So as soon as you complete that member's level of care in the UAS and they come out eligible for HCBS, you have 30 days to create an HCBS plan of care. If the referral is coming from CES, they're coming to you with a level of care, and you have 30 days from the date you accept that referral and enroll them in Health Home to get their HCBS level of care completed. Next slide. The other thing that was noted on our audit is that we are not having documented conversations with our HCBS youth and family on how to file reports of suspected abuse. So there is something called an HCBS toolkit that I have distributed out to supervisors and some care managers that contains every form that you could possibly need for HCBS. And one of those forms is the Children's Waiver Participant Rights and Responsibilities form. This form, flyer, document contains all the information that you'll need to go over with the family that coincides with that freedom of choice form. So they sign that 5276 form, but then they also should be getting this document. And what we're finding in audits and what the state has found is that this document and form and flyer, whatever you want to call it, is not in our record and it doesn't need to be, but there is no documented conversations occurring that this form was reviewed with the family. So moving forward, what we would like to see in order for us to ensure that our families are receiving review and education on this form is that you have 2 copies of the form. The family is going to initial 1 copy and you're going to upload it. That will be the acknowledgement that you and the family have reviewed this form here. And then the other copy is going to go to the family. And if you have the current HCBS toolkit, this is number 25 in that toolkit. It's again, I just did a quick screenshot. So when you look for it in the toolkit, you'll be able to locate it. But if you have any questions on this, you can also email me and I can send it to you. Next slide. the other thing that we went over for audit results, which has been on previous years, has been our safety and crisis planning. We need to make sure that all of our youth, not just our HCBS youth, have a safety and crisis plan in the record. And it has recently been updated to a new form. So moving forward, everyone has to use the new version of this assessment. It's under additional forms now. It's no longer located under assessments because it is a unique form to AHI. We have to make sure that anytime any of our members experience any sort of safety or crisis issue, that we are reviewing their current safety and crisis plan. If we review the plan and no updates are needed, then you'll just note that in a note in the record. But if you are reviewing the plan and there is an issue with safety or crisis planning or an admission of some kind, and it does need to be updated, that you are updating that with the family. The other new thing this year that the Department of Health has pointed out is that if we are having families that are chronically experiencing some sort of safety issue or a crisis in the home, that this actually be incorporated into the plan of care. We want something in the plan of care that's going to address the concerns of the safety and the crisis planning. So it could be as simple as adding, quarterly we'll review the safety and crisis plan, or we'll work with the family on safety and crisis planning, or anything that they may be working with a provider with can also be included in the plan of care. They want to see that families who are chronically experiencing safety issues and crisis issues, that there is something in the plan of care that is addressing these concerns. And that was a new area that needed to be addressed for year 3. And lastly, what they have highlighted for us is that we need to be continuously monitoring HCBS services. So if you make a referral for HCBS services, we should be following up monthly with, or attempting to follow up monthly with the provider we made the referral to. And if the member is connected to HCBS services, we should have monthly communication with that provider to oversee those services, make sure everyone is showing up for their appointments, see how services are going, making sure that we're getting the authorization forms so we can add frequency, scope, and duration to our plan of cares. If you are reaching out to providers and you're not getting a response, make sure that you are documenting those attempts to communicate with providers in the member's record. Next slide. Okay, so those were our year 3 results. So how can our supervisors and our CMAs help support our care managers with this complicated HCBS workflow? We want to make sure that all of our supervisors understand all of our HCBS policies. A lot of our HCBS policies are standalone policies. They're not really incorporated into our other children's policy due to the complexity of this program. They needed to be standalone policies. We want to make sure our supervisors are familiar with them. They're all on our website, as Travis said earlier. The other thing that we have is our HCBS toolkit. I have periodically distributed this to all of our CMAs. Typically it goes to the supervisors. This toolkit will have every form that you may need to complete, every flyer. It has some examples in there of plans of care. You want to make sure that when this is sent to you, that you are either putting it in a location where all of your care managers can access it, or you're forwarding it to them. This way that anytime they need to reference a form, that they have it on hand. And there is also a audit tool specifically designed for HCBS. So all of our CMAs should be internally auditing their HCBS charts, just like they audit their mainstream health home records. So these are some of the things that supervisors can do to kind of help support this process. And then at any time, if anyone has any questions, you can always reach out to me. If you want another training in any capacity, if you just want to talk through the process, you can always reach out to me and we can send something up. Does anyone have any questions on any of that? That was a lot of information.
It's a lot of audits in a short period. Year 1, 2, and 3.
A lot of audit fun going on over here.
Well, as always,
Okay, well,
thank you,
yeah, I was
Jessica.
just gonna say, if you have any questions, you can go ahead and email me or call me or text me. You have my number.
Yep. Thanks, Jessica. Yeah, don't be shy to reach out if something comes up for questions. And just want to do one more check on the HCBS disenrollment policy. If anybody had any questions on those updates. Okay, we'll keep moving forward. So NetSmart. So some updates on that. So October 3rd, so next Monday, there's going to be a new format for the comprehensive assessment. I know we brought this up, I think it was like March of this year. NetSmart was working on building this new form template for the comprehensive assessment. And here we are going into October and it is going to be implemented. So there was some back behind the scenes engineering platform stuff that they were contending with through NetSmart, which brought the delay along. And then we had some testing that we did as a health home through our UAT environment that we had found some things that weren't just jiving as far as updates. So we sent that back for feedback. And so it was some back and forth over the months, but nonetheless, this new template's coming out. It's going to be appearing slightly different as you see in this screenshot. It's, in NetSmart's words, more of a modern feel, more of a modern touch, if you will, when you go into the new assessment. We're told that it's much faster. The delays are supposed to be, the days of the delay are supposed to be gone or minimized. I don't know if I can ever say gone totally because things happen, but supposed to be minimized, supposed to be much quicker to get through the document as you're doing the assessment. So that's one good thing. The next thing, there's not a landing page any longer as of October 3rd on the new form, but you'll be able to click at the top as you see the different headers as far as the forms go to get to where you want to go. Or there's a menu button on the right-hand side now that you can click and get to the form. And it'll get you there where you want to be. The other thing is validation errors. So if you click on a field that's required and then click away and that's a necessary field with the asterisk, it's not going to let you go any further as in the past, the platform has that on certain forms. But this is going to stop you dead in your tracks, if you will, and you have to fill that out before you go any further. And then along that line, there's a auto save and a save function that we'll talk about shortly. But you're going to get a pop-up screen now when you try to save if you haven't completed fully, and it's going to give you the details why. And then you can click on the link that'll take you directly to that particular question. And so that's a change that wasn't there before. And then there's autosave and save. So one of the things that NetSmart wanted us to point out to our group through the network is that the autosave function is a temporary thing. So it shouldn't be used as your save function, if you will. You should always try to save the document, click save versus use that autosave feature. It doesn't replace the save button, basically. So if someone accidentally exits out of the form before they save it, this auto save function is supposed to kick in and help. But we don't want to use it as our tried and true method because it's a temporary thing. It's not an indefinite save. And that's just something that, we wanted to note to you as you're starting to venture into that new format. Again, that's happening as of the 3rd. If there are any questions or concerns that pop up as you're getting into the new format, please let us know so that we can communicate that as well. We're hopeful that that's going to be minimized or not happen. You know, hopefully it's a much more user-friendly form for everybody. Taylor, did I miss anything as far as updates beyond what was mentioned?
I just wanted to mention that all of your current comprehensive assessments, both initial and annual updates that are in the members episode will flow into the new form. So when you guys go and click on the comprehensive assessment on Monday, you should see all of your current comprehensive assessment versions in there as well. And if you don't see those, shoot us an email to the Health Home email and let us know, because all that data is supposed to move over to the new form.
Thanks, Taylor. Yeah, that's an important piece to know. Thank you for bringing that up.
Yep.
So
Quick question, if you have a comprehensive assessment in draft, will that carry over on the 3rd?
Yes, it will.
Thank you.
Everything's supposed to go into that new format. That's what we're told.
Oh,
Yes.
It's just Lori. I'm just curious, was there any rationale of why that autosave and save, I mean, why it's even there?
Nothing that was really explained. The only thing I'm thinking of is, as you're asking, is, people were losing all the work that they were doing in the past, and they weren't able to retrieve, and NetSmart was having a hard time retrieving if there was a work ticket put in, and it made many people upset and disgruntled for very good reason. So I'm taking a stab to think that may be a reason why the autosave function is now a capability.
But if it's temporary, so are they testing it to see if it's going to work maybe? I guess it doesn't matter, but I'm like, well, why create something that's temporary that actually sounds like a lifesaver?
Yeah, possibly if I had an oops and then I went back in right away, not all is lost at that point.
Okay.
You raise a good point though. How long is that temporary time frame? I don't think we asked that question. We have a bi-weekly meeting. We can bring that up and just see what kind of response we get on that.
Okay.
That's a good question.
Will the
I will say that
PHQ-9
the
be built into?
autosave, go ahead, sorry.
I just had a quick question. Will the PHQ-9 be built into the assessment like the substance abuse ones are? Or will that still be in the separate tab?
I think it's separate through a link through the assessment still. Am I correct, Taylor?
Yes, it's still separate, but they tell us with this new form that we should have some capabilities to maybe edit things, so it's a possibility that we could put it in there, but as of Monday, it will still be separate.
Yeah,
Thank you.
the goal is for us to eventually have some more capability to make adjustments to certain forms in the system, whereas now we can't. We have to fully depend on NetSmart. So this new template that they're building, that this is on, is supposed to be one that's going to allow us to do that after some time goes by, and they've tested it thoroughly to make sure the bugs are worked out, etc. So we're excited about the fact that we'll have more ability to get in there and make changes on our own.
Travis, just quickly going back to Lori's question about the temporary saving. When we tested it in UAT, the auto saves still appear to be there like weeks later. So I think that they might just be trying to cover their butt. But just keep in mind that it might not be forever. But through UAT, it's been showing that it's been hanging out for a while.
Yeah. Yeah, we'll ask the question too. I mean, that's good feedback, Taylor. But I'd be interested to know if they have, do they have it set for 3 months? Is it indefinite? Is it 30-day? As they move it to production. All right, great. Thanks, Taylor. Any other questions around the comp assessment? Okay, well, please let us know if something comes up, if things aren't working the way they should be. The next thing is around care plan objectives and interventions. So this was just turned on recently in production. NetSmart made the announcement through their updates that there's drop downs now. So you can actually go, you'll see on the top of this particular slide, objectives and arrows over to the interventions. You can minimize or you can expand now onto those different objectives and interventions. So that's kind of neat that's something that's available if folks are interested in that. So you can have it so they can lay them out for you so you can see it all in one spot, or minimize it within that category. And that was it for that. COVID-19. Well, before I get to this, any other questions around NetSmart in general? Anything anybody want to talk about, bring up, anything? Okay. I just bring this slide up. I know we've talked ad nauseum over the last couple of years about COVID-19 and the emergency waivers and whatnot. And as of now, the federal emergency waiver is set to expire on October 13th. Unless for some reason that changes, that's the information we have to date. And then OMH, New York State OMH Commissioner Regulatory Waiver actually ends October 4th. So next Tuesday, that's going to end. And I have not heard or seen anything different from that. So that would be in particular to our special mental health population or Health Home Plus folks that we're working with. So that's going to impact greatly the face-to-face requirement, the 2 face-to-face monthly, 4 contacts in total. So I just want to reiterate that to folks. I know you're well aware of it out there, but I just wanted to bring up that this is coming to an end unless for some reason something comes up between now and then, and that's changed through the commissioner, through OMH, or through CMS on the federal level. These dates will be the end dates. We've talked about quite a while through our health home, trying to get back to business as usual as much as possible, to work towards those face-to-face interactions where they're required. The verbal approval versus electronic or wet signature, that verbal is going to go away. So just want to keep that in mind. I know folks have been working towards it, but I just wanted to highlight that again, that, it is coming to a close here. So just FYI, I don't know if there's questions, or anything anybody want to talk about around it, but these are the dates as we have them as of now.
Travis, it's Lori. Do you know if they're going to build anything so that if somebody is COVID positive, that then you can do one of those contacts via phone, only in that, a documented positive?
I haven't heard that specifically, Lori. Specific to DOH Health Home, we haven't gotten any update as of recent. I know we just had a change on the director level on the state for the health home. Serena Master is now the director for health home. Peg Elmer just recently transitioned out of that role to go to another department within the department through New York State. And but we haven't gotten an update throughout this transition over the last month and a half on that type of status, or even that 60-day ramp up. That was one thing that I know in Peggy's tenure, she was saying that we would be getting notification. CMS was going to give Department of Health 60-day ramp up period, et cetera. We haven't specifically heard that recently. So I don't know particulars around like the question you just placed. I wish I had more to say at the moment on it, but I think if you have those circumstances come up, reach out and we can explore those answers together. We can reach out to DOH specifically and ask, until we get more formal communication about it.
Okay. Thank you.
Yes. Any other questions or comments around the waiver, the COVID-19 expiration? We'll certainly get more info out as we get it. I just didn't want these dates to come and pass without folks, being reminded about it. I know we brought it up along the way, but it's fast approaching now. So, next topic was the North Country Care Coordination Collaborative. I brought this up a couple times over the last handful of months. I've sent some notifications out to the network just on trainings that are offered. I just want to do a reminder of some upcoming. We have one coming up tomorrow. That's skills of calm and de-escalate emotionally dysregulated patients. So there's a registration link for that, and then there's a burnout series, and well-being with Kim Perrone, and those dates are coming up for October 19th, November 16th, and December 14th. So there's also, through those dates, different topics: work-life balance, self-care, managing priorities, and the registration link is there below that as well. Just want to share those. Those are free trainings. I just thought they would be good for our care management folks out in the field. Others in your organization, if they think it's relevant for their own work, great. It's free. We'll spread the wealth, share the wealth, so they're there for folks to utilize if they feel they like to. Those are our team as usual. So any questions? There's a Health Home email. I did want to know on our next slide here, we have another organization. So we had St. Joseph's Rehabilitation Center and People USA that are going through the process of securing an MMIS ID number. Shelters of Saratoga and Saratoga Springs is also working towards that currently. So they're looking to become a provider within our network as well. So I added them to our list of organizations that are going through the process to be able to be onboarded to be in our network. So those are 3 that are in the hopper, if you will. And then, of course, the rest of our team, the rest of the network that we have in our health home is listed as well. Shelters and St. Joe's and People USA at this point are going to be concentrating more on the adult side of the house. But that could change depending on when they get in and what populations they want to look to. But for the moment, that would be the area that they would be looking to start serving and supporting folks with. And that's all I had for today, unless folks had questions or anything they wanted to talk about. Check the chat, just see if anything came in. Well, last I see is skip my parts, I'll be back. That's Jessica, so doesn't look like we have anything after that. If no one has anything, I hope you all are enjoying what's becoming our fall season, and you can enjoy that before the weather really starts to turn on us. And as always, thank you for all that you do, and I hope everybody has a great afternoon. Take care, everyone.
Take care.